My name is Steven Vasquez. This is my bone video for the axial skeleton. You have the cranial bones, the frontal bone here. You have the parietal bone here, occipital bone back here, the external occipital protuberance here, and that attaches the ligamentum nuchae, the temporal bone here. You have the temporomandibular joint here, the mastoid process here, the styloid process right there, the external acoustic meatus here, the squamous part here, the pitris part here, and what's housed in there is the middle and internal ear cavities, which have the hearing and balance sensory receptors. The internal acoustic meatus is here, and what passes through there are the cranial nerves 7 and 8. The external lateral view of the greater wing is here. The orbital view is here. The superior orbital fissure is in here, right there. And what passes through there are the cranial nerves for eye movement. The lesser wing is here. The greater wing is here. The optic canal is here. And what passes through there are the optic nerves. The sella trussica is here. And the structure that sits there is a pituitary structure. The ethmoid has a crista galli, which is that ridge there, and that secures the brain to the cranial cavity. The cribriform plate, the olfactory nerves pass through there. The coronal suture is here. And that's between the frontal bone and the parietal bones. The sagittal suture is here, goes between the parietal bones. It starts at the frontal bone and back here ends at the occipital bone. The lambdoid suture along the occipital bone and the parietal bones. The squamous suture is here. That's between the temporal bone, the frontal bone, and the parietal bone. Facial bones, maxilla is here. The alveolar process is here. The zygomatic bone, or the cheekbone's here, and that's made up of the zygomatic bone and the zygomatic process of the temporal bone. The inferior nasal concha, or the two bones that make up the bony nasal septum, are the vomer and the ethmoid. The inferior nasal concha here on both sides form the lateral walls of the nasal cavity. Okay. The mandible, you have the body, the angle, the ramus, the mandibular condyle is here, the mandibular notch is here, The coronoid process is here. The vertebral column has 4 curves. It has a cervical curve, the thoracic curve, the lumbar curve, and the sacral curve down at the bottom. The cervical vertebrae has 7. The atlas is here. Okay, and that bone articulates from the superior aspect to the occipital condyles, which carry the skull, and the atlas allows you to nod your head yes. The axis is right below the atlas. That one allows you to say no, to move your head no. And what's unique about the transverse processes from the other vertebrae are these transverse. They have transverse foramen, which carry the vertebral arteries pass through to service the brain. The thoracic vertebrae show 12. Okay. The spinous processes are here, pointy part, right there. The transverse processes here. Okay. The intervertebral foramen, the spinal cord goes through there, it's inside. You can see the metal rod. This metal rod goes through all the curves, so that's where the spinal cord would pass by or go through. The centrum is here. Centrum, the body of the thoracic, it should be up here. Okay. The position of the intervertebral discs are right here. You can see them right there. The lumbar vertebrae has 5 vertebrae. The sacrum is made up of 5 fused vertebrae. And that's right here. That's the sacrum. Coccyx is right here. The tip right here. On the sternum, you have the manubrium here. You have the body here. The xiphoid process here. And the jugular notch up here. For the ribs, you have the true ribs, where the first 7 going down. Next is the false ribs, and then the floating ribs, which are the ones that are not connected to the sternum. And that concludes my video on the axial skeleton.